What happens during my first orthodontic consultation?
As the patient walks in, the patient obviously has some concern. The patient will be coming in with a concern, say regarding like, I don't like the way my teeth look, or my smile is not the right way, or I have difficulty in biting, or my teeth are like feeling very sensitive as I bite because, sometimes the teeth are grinding against each other, resulting in chip and wear. As the patient comes in, we take a look, we take some x-rays, some pictures, we do some analysis, which could be, testing if the teeth are the right size in the jaws are okay. So we do all these things. We come up with a complete diagnosis for the patient. Once that's done, the patient will be given a treatment plan. This is what we cater to do. You are a good candidate for Invisalign, or you're a great candidate for braces, or this is the appliance you would need to get rid of your habit. Once all of that is done, the next step would be, of course, discussing the finances with the patient, making sure patient is comfortable, et cetera, et cetera. That is obviously very, very individualized with every doctor and every patient. All of that would be fine. Once everything is all the records are set, everything is set, all the finances are set in place, and the patient is happy with what they see, they usually come in, and that's the first point would be putting the braces on. Once the braces are put in, we make sure the patient has given all the instructions, cleanliness instructions, taking care, biting instructions, coming back, how often they need to come back. And obviously you have the choosing color options, the patient, especially teenage girls, love to choose the nice colors, springy colors or winter colors, depending on whatever they would like. Once the braces are in, the patients usually come in, like I said, every single month once. We change the wire, make sure the patients are okay, everything is good, patients are not uncomfortable, nothing is poking the patient, the wires are not long, brackets are not broken, and it goes on. Once the treatment is nearing the end, we usually give, in our specific practice, we usually give the patient something called a fixed retainer, which will be a piece of wire that goes behind the top and bottom front teeth to make sure we give good retention to the patient, just make sure the teeth are nice and retained, like in the place we finish the orthodontic treatment with. Apart from the fixed retainers, we also give something called removable retainers to our patients, again, which is done later on, like in the end stages of the treatment.